Everyone, we are the Group 22 and today we are going to tackle to you about the Filipino culture, characteristic, and healthcare belief practice in the healthcare education. Filipino culture, a rich blended of indigenous tradition, Spanish colonial influence, and American impact, significantly shapes the healthcare practice and necessitates cultural sensitivity, healthcare education. The key characteristic like the family-centered decision-making, respect for the elders, the influence of the hiya, shame, and the pakikisama is getting alone. The prevalence of the additional healing practices alongside modern medicine must considered in designing effective healthcare education program. This program must be engaged family, respect elders' authority, create safe space of open communication, and integrate the traditional practice where the appropriate to ensure the culturally competent and impact of the health promotion.
Culture. The relationship of culture and health is important to understand as it impacts an individual's worldview and decision-making process. It is not limited to any specific ethnic group, geographic area, language, religious belief, manner of clothing, and sexual orientation and socioeconomic status.
Filipino culture, being an archipelago consisting of 7,107 islands, its culture influence in the Philippines important to recognize give that extent of 1,175 ethno-linguistic group of each with their own cultural identity of health, beliefs, and practice. Summer institutions of linguistic 2020 to settle.
Let's move on to cultural awareness. Cultural awareness is a prerequisite prior to achieving cultural competency. It is the understanding that a cultural divide exists between the patient and health professional. Cultural awareness means recognizing differences, understanding you and another person, like a patient may have different beliefs, values, and way of seeing the world based on your backgrounds. It is the beginning of learning how to work well with people from different cultures. Basic recognition, simply acknowledging that cultural differences exist between you and others. In healthcare, it means doctor or nurse understand that their patient might have different beliefs about health, medicine, and treatment based on their culture. This recognition is just the starting point before developing deeper cultural skills. Think of it as noticing cultural differences before you can truly understand or work effectively with them.
Cultural competence. When we say cultural competence, this refers to a person's ability to interact effectively with patients of culture different from his or her own. Regarding to healthcare, cultural competence is a set of behavior and attitudes held by clinicians to communicate effectively with patients of various culture and to the individual. This talks about our ability to provide care that is respectful of and responsive to the health beliefs, practices, and cultural and linguistic needs of diverse patients. Example, to those some religions like Jehovah, which is as a clinician, we have to show respect to their health beliefs and also those some illiterate patients and many more. Being cultural competence is very crucial, especially for us clinicians or healthcare providers, to have effective healthcare and to build rapport with our patients.
Let's move on to common Filipino cultural beliefs. Inheritance, namamana. A behavioral or disease trait from a parents. A belief that when a relative has the condition, it is possible that she will pass on the trait to the younger generation. Like for example, yung mga parents mo, may diabetes, tapos may chance ka na manahin mo or magkaroon ka rin ng ganyang sakit. Number 2, conception or maternal cravings. Lihi. It is believed that an offspring will take the features of the food that the mother has craved from her for while she is in the period. Ito yung mga common sa buntis na may gusto silang kainin o amuyin. Number 3, hot and cold syndrome, PASMA. PASMA is roughly defined as an exposure illness which appears when a condition considered to be hot is attacked by a cold element and vice versa. Hot and cold syndrome, also known as PASMA in Filipino folk medicine, is a condition where the body experiences unusual temperature changes or sensation. It's based on the idea that sudden temperature change can disrupt the body balance and cause health problems.
Courses, Sumpa and Gaba. Sumpa is the curse that inflicted by a human being. In contrast, Gaba is a curse inflicted by a divine being, and it is usually God. Sumpa is a curse from another person, while Gaba is a curse believed to come from God as punishment for bad deeds.
Mythical and supernatural causes. Namaligno. Namaligno is used as an explanation in conditions which remain to be mysteries because of the absence of an apparent cause. Mythical causes. For example, if someone gets sick and there's no clear reason, it may be blamed on supernatural beings like spirits.
God's will o kaloob ng Diyos. When a Filipino individual experiences an unexpected event in their life, whether negative or positive, it is typically attributed to the grace of God.
For example, a person might attribute their recovery from illness to God's intervention and will, expressing gratitude for the healing. Similarly, some people might view challenges or hardship as part of God's plan, trusting in His wisdom and goodness.
Lastly, we're going to talk about Filipino health practice. What is Filipino health practice? It is a blend traditional folk remedies with modern medical approaches, incorporating beliefs about relying on family and community support. There are 4 types of Filipino health practice. First is traditional form of self-medication. Self-medication is the selection and use of medicine that includes herbal and traditional products to treat your own self. For example, ointment which serves as a cure in relaxing, heating and comforting the muscles, or providing relief for dizziness, cold, and headaches. Number 2, folk healing techniques. It is a traditional practices often rooted in cultural beliefs and indigenous knowledge, used for treating illnesses and maintaining well-being. These practices pass down to generations and may include herbal remedies, rituals, and spiritual practices. For example, doing prayers or rituals when someone is namaligno.
By continuing the 4 Filipino health practices. The third one is alternative therapy. The alternative therapy is the practices of hilot as a primary example of alternative therapy in the Philippines. Hilot is used for pain and ache relief, often chosen as an alternative seeking conventional medical attention. This suggests a preference for traditional healing method with certain segment of the Filipino population. Potentially, consideration or accessibility of healthcare services. Further, research could implore the prevalence of hilot and other alternative therapies. The types of ailments they are used to treat and integration or lack therefore within the mainstream healthcare system. One is home remedies. Home remedies as involve consultation with a location healer who employs various treatment including herbs and roots. This points to a reliance on including medicine and the expertise of local healers within the Filipino community. The use of herbs and roots underscores a connection to a nature and traditional knowledge in addressing health concerns. Further, investigation could delve into the specific types of herbs and roots use, their efficacy, safety, considerations, and the role of knowledge transmission within families and communities. The citation of Mackenzie and Chrisman on 1977 suggests that this practice has been documented and studied historically, indicating a long-standing tradition. In conclusion, both alternative therapy, represented by hilot, and home remedies involving local healers and herbal treatment represent significant aspects of Filipino health practices. Further, research is needed to fully understand the scope, effectiveness, and integration of these practices within the broad healthcare.